in kids is reversible. So this is an article by Sindhu Jain at Chennai. So all of this doubles in 2 decades. And as they've said, management and prevention, screening annual blood pressure checks starting at age 3 are recommended, with more frequent checks for high risk kids, including obese children. Dietary changes: limit sugary drinks, salt, aim for less than 1500 mg per day, and processed foods. Focus on water and low cholesterol options. Physical activity: encourage regular exercise and outdoor play. Medication may be needed if lifestyle changes aren't enough, especially with signs of organ damage. So here we go. Childhood hypertension has nearly doubled in 2 decades globally, affecting children under the age of 19 years, according to a study recently published in the Lancet Child and Adolescent Health. So, unhealthy combo is this: studies point out that there is a large percentage of obese children developing hypertension compared to healthy weight kids. Obesity and hypertension stem from unhealthy lifestyles, high intake of processed foods, sugary drinks, and salt, coupled with less physical activity. So, this duo sets children on a path for serious adult cardiovascular problems, including heart disease and stroke. Contributing factors for all of this is diet, inactivity, global rise is there also. So, diet is increased consumption of salt, unhealthy fats, sugary items. All of this directly raises blood pressure. For inactivity, you will see that there's more screen time, less outdoor play. So, all of this is contributing to weight gain and hypertension. Global rise: these issues are increasing worldwide, affecting children at younger ages. Let us go on to see more about this. According to the researchers, obesity is the leading cause of this problem. However, there is a ray of hope. As doctors say, this condition in kids can be reversed with lifestyle modifications. This otherwise would lead to adulthood hypertension. If you take the case of 12-year-old Anand, name changed, who was brought to the hospital with borderline blood pressure. He was overweight, his screen time was very high. After changing his routine, bringing down his screen time, and then adding cycling to his routine and implementing a fixed sleep cycle, his BP returned to normal within 3 months. Childhood hypertension is very much reversible in most cases, said Dr. P. Subhash Chandra Bose, who is a senior consultant pediatrician at SIMS Hospital, SIMS Hospital. Next, we see what the study found. In the meta-analysis of data from 96 studies involving more than 4 lakh children, researchers found that the prevalence of high blood pressure in children and teenagers under 19 years has increased to 6.2% in 2020 from 3.2 in 2000, affecting around 114 million children globally. The study also found that an additional 8.2% of children fall into a pre-hypertension or elevated blood pressure category. The blood pressure levels rose sharply during early adolescence, peaking around 14 years of age. The blood pressure was higher in boys than girls. So between 2000 and 2020, the prevalence of childhood hypertension nearly doubled, increasing from 3.4% to 6.55% in boys and 3.02% to 5.82% in girls. It is reversible. According to WHO, being overweight during childhood and adolescence is associated with greater risk and earlier onset of various non-communicable diseases such as type 2 diabetes and cardiovascular disease. Childhood adolescent obesity has adverse psychosocial consequences. It affects school performance and quality of life, compounded by stigma, discrimination, and bullying. Children with obesity are very likely to be adults with obesity and are also at a higher risk of developing NCDs, in adulthood. Poor activity, poor diet, inactivity, family history of hypertension, stress at school, and obesity were found to be the leading causes of hypertension in children. However, lifestyle modifications and early diagnosis can reverse this condition in children, says doctor. Kids are moving much less now. Their screen time has increased. Food habits have changed. Obesity is a big factor. But children who are not overweight also can get high BP because of stress, poor sleep, family history, and many other reasons, said Dr. Subhash. Childhood BP can actually predict adult BP. So, if diagnosed early, long term heart and kidney issues can be prevented in adulthood. Children don't show clear signs of BP mostly, but parents should watch for morning headaches, tiredness, more than usual, irritability, breathlessness, with small activity, sudden weight gain, and snoring at night, added Dr. Subhash. Hypertension without any underlying cause is very rare in children, unlike adults. Once the underlying cause is addressed and treated, the hypertension usually resolves, said Dr. Janani Shankar, Medical Director of Kanchi Kamukoti Children's Trust Hospital. What parents should do from the age of 3, it is advised to have the BP checked annually and more frequently. If the child is overweight, premature, has kidney issues, or has a strong family history of hypertension, parents can ensure that children have physical activity at least 40 to 50 minutes daily. Avoid biscuits, sugary drinks, cut down on extra salt, and reduce taking chips. Their sleep cycle should be regular, include more fruits and vegetables in their diet, and always prefer homemade food, said Dr. Subhash. The prevalence of hypertension in children is more prevalent in urban areas, said Dr. Pushkala, consultant pediatrician, Kaveri Hospital, Chennai. Hypertension caused by obesity could be due to insulin resistance, changes in the blood vessels, and family history of hypertension. Children with these risk factors should be screening early. We have to screen children in pre-hypertension phase, even before it causes symptoms or damage. Screening should be done regularly in clinics, even during school health checkup. Emphasis should be on active and healthy lifestyle and health education. If the child is consistently found to be hypertension or not responding to lifestyle modifications, this will cause end organ damage. At this stage, the child might need medications to control blood pressure, said Dr. Pushkala. In a 2023 study, the researchers found that the prevalence of obesity was 8.3% in children and 12.4% were overweight. So, this is actually more in number in boys than in girls. The incidence of obesity was more in children with family history of hypertension and also who had both parents working. It is predicted that the prevalence of obesity and overweight in India by 2030 will be around 11%. So it should be controlled, added Dr. Pushkalha. Now, another thing that we can hear about is about the pulse of matter. So, in this article, we're going to be reading about post operative care in comfort of home with telemedicine. So, it is understandable for any patient to have queries regarding the treatment and medications after discharge. It is also quite common for patients to experience insufficient post operative or post intervention pain relief. This is often due to a lack of understanding about available pain management strategies. These issues are compounded by limited infrastructure and access because of personal, social issues, and shortage of medical personnel. Digital healthcare, including telemedicine, presents a viable and impactful solution to these post operative problems. So, while surgery aims to alleviate pain and improve health, Post-operative complications can cause distress, negatively affecting patient outcomes and extending recovery periods. A study analyzing the impact of postoperative care found that the incidence of disability free survival at 3 months after surgery was 75.7%, a decrease from the preoperatively estimated rate of 85.6%. Telemedicine provides patients with convenient access to specialists while they recuperate at home. Furthermore, similar to other digital healthcare tools, telemedicine platforms furnish detailed information about physicians, their practice, and patient reviews and feedback, enabling patients to make informed decisions about their post operative care. This continuous feedback on the quality of post-operative care not only helps current patients but also contributes to transparency and accountability, informing future patient choices. How telemedicine enhances post-operative care? In 2019, 76% of US hospitals use some form of telehealth to connect with patients and providers through digital and video technology. Over the years, telemedicine has emerged as an efficacious tool providing patients with access to specialists irrespective of the location. In the case of patients who have undergone surgery, telemedicine has several benefits to offer both to the patient and provider. Enhancing monitoring and support. Continuous monitoring is a key post surgery thing that you can do to catch signs of complications such as infections early, early. So, continuous monitoring via smart devices, example wearables or apps that can track recovery in real time and provide insights to doctors. A study by an Arizona cardiology practice found that remote patient monitoring RPM led to a 50% reduction in 30-day readmissions for patients with heart conditions, reducing reducing readmissions. Another major challenge that patients may face is the prospect of readmission. Through remote consultations, doctors can monitor progress and adjust their treatment plans before complications occur or halt their development. Cost efficiency. India is among the countries with the highest out of pocket expenditure, 62.6%, when it comes to healthcare expenses. Furthermore, for patients living in isolated areas, the cost of traveling to healthcare facilities adds to the burden. So, telemedicine can significantly bring down the costs for patients by enhancing accessibility and for healthcare facilities by reducing administrative and travel costs and catering to more patients. Many patients who undergo surgery are often in a fragile state and require extended periods of rest. In such cases, traveling may be detrimental to recovery. Furthermore, when patients receive care remotely, it leads to higher satisfaction and treatment adherence. Providing data driven insights, telemedicine platforms often collect information about patients who can collect doctors glean valuable insights regarding recovery patterns, enabling them to personalize treatment plans. eSanjeevani, India's national telemedicine service, has rapidly evolved into the world's largest documented telemedicine initiative, in primary healthcare. As of February 5th, 2025, the platform has served over 342.9 million patients through 131,152 Ayushman Arogyan Arogya Mandirs, formerly health and wellness centers, supported by 16,957 plus hugs at plus hubs at secondary and tertiary health facilities, including medical colleges. Additionally, more than 692 online OPDs are staffed by a network of 231,250 telemedicine practitioners, including doctors, specialists, and health workers. So, this is information provided by Dr. Neeraj Ashwati, who's a director of pediatric and congenital heart disease from Fortis Escorts Heart Institute. Hope this is useful.